the Science, Legality, and Effects of COVID Mandates. My name is Neetu Arnold, and I'm a Senior Research Associate here at NAS, and I will be serving as the moderator for this discussion today. I am delighted to welcome Todd Zywicki, a professor at George Mason University, and Joni McGary, who's the founder of the organization No College Mandates. We're also waiting on a third panelist, Martin Kulldorff, if he makes it here, but he's an epidemiologist and biostatistician who also co-authored the Great Barrington Declaration. I will probably have Todd Zywicki speak first and then followed by Joni, and if Martin makes it, we will have him go after that. Each panelist will talk for about 15 to 20 minutes, and they will give their remarks. This will be followed by a Q&A. You can submit your Q&A either through the chat or the Q&A button at the bottom of your screen. And then this webinar will also be available for later view on the National Association of Scholars YouTube channel. I did want to preface this discussion by saying that the webinar is not meant to serve as a forum to tell our viewers any medical advice or whether they should or shouldn't receive a COVID vaccine or a booster shot. This webinar will focus more on the policy aspect of the discussion. So with that, I will have Todd Zywicki take the stage.
Thank you, Neetu. As mentioned, I'm a law professor, and back in March 2020, basically the first week of March, I had COVID. So I was an early adopter of COVID. I turned out I was at a conference in New York City the last weekend of February, and had to wait in Penn Station for a couple hours for a train. And in retrospect, COVID was probably about the fifth most dangerous thing I was exposed to in Penn Station, hanging out there for a few hours. But a few days later, I turned up with COVID. I couldn't, at the time, I did not have what were considered COVID symptoms, so I didn't get tested. But a few weeks later, they added my symptoms to the list, and I was pretty sure I had it. So when fall 2020 came around, I volunteered to teach in person. Now, let me make clear, I am over 50. I'm in good health, but I'm over 50. But I was told at the time by Anthony Fauci and others that if you were infected with COVID, you didn't have to worry about getting COVID again. That basically that you would get durable protection from natural immunity. And so I had an antibodies test done that summer. Of course, it came back positive. And so I volunteered to teach in person and taught in person all during the 2020 school year. At the end of that time, of course, the vaccines were rolled out in spring 2021. And I thought, well, thank goodness I've basically had to put my life on hold while everybody else was afraid of getting COVID. And I knew I was safe because I had COVID and recovered. And I thought, all right, well, now everybody can get vaccinated. We can get back to normal. But little did I know that at that point, the university would decide that they were going to make everybody get a COVID. They were going to impose a vaccine mandate, including on those who had already had COVID. So I tried to work with the bureaucrats at the university and explain to them that that I had already had COVID. I didn't need the vaccine. And basically their response was just to blow me off. So the next time I contacted them through my lawyers at the New Civil Liberties Alliance. And while I am a law professor, I was actually the client in this case and not the lawyer. Although obviously I was involved in the litigation. And so we made a demand letter, and then eventually we sued them for their mandate policy. And eventually I received a medical exemption, and my case went away. But in that case and following that case, I've obviously followed the litigation, the legal aspects of all this. So I'm going to talk to you for a few minutes about the general question of vaccine mandates. And I'm going to talk from a legal perspective. and then I'm going to talk specifically about some of the issues that arise from this. So I was able to sue under the Constitution because I am a professor at a state university, and the state universities have to abide by the Constitution. Private universities do not, generally, with respect to matters like this, just as state employers, which I'm employed by the state, are required to abide by the Constitution on matters such as the First Amendment and the like. But private employers are not required, for example, to abide by the First Amendment, unless there's, for some reason, some statute, some law that ties their behavior to the First Amendment. And so I'm going to talk first, I said, a bit about general vaccine mandates as they relate under the Constitution. And then second, I'm going to talk about my specific case and the particular issues that are raised by the nonsense and the nastiness the universities are imposing on young people today. So the general question of mandates goes back to a case that many of you have heard about, which is a case called Jacobson versus Massachusetts, which back in the early 19th century upheld a Massachusetts law implemented by the city of Cambridge that required individuals to get a smallpox vaccine or face a fine of $5, which is about $155 today. That was it. If you didn't get the smallpox vaccine, you were fined $5. Henning Jacobson decided he didn't want to do that, and so challenged the case. And the Supreme Court, it went up to the Supreme Court, and the Supreme Court upheld the smallpox mandate and said that it was consistent with the Constitution under what is called the police power of the Constitution, which gives the state the authority to regulate in the name of general welfare, morals, and the like. This includes things such as opening and closing times for bars, and a variety of other sorts of things, including they held efforts to control infectious diseases. But there are two very important aspects that they had for that. First, which is that a mandate is only constitutional if it is an effective and necessary way to prevent infection and transmission of a contagious disease. It cannot be justified simply on the fact that it might be good for you. That's up to you. That's a matter of individual liberty. It has to be shown to be a reasonable means to prevent community transmission of a highly infectious disease. The second aspect of it is that it must be consistent with the Constitution. And this is where courts have let us down over the past few years, which is they have failed to understand that important caveat, that important restriction on the state police power, and they have failed as a result to understand how the law has progressed in the meantime. Now, there's one other thing that's very important about the smallpox vaccine, which was that it had been around for over a century at that point. It was well established at that point to be safe. It was well established to actually prevent transmission, which is unlike these COVID vaccines, which we'll talk about in a minute. And so, but courts have basically looked beyond all that, and they have simply waved their hands and allowed these things to go through. Now, why is the restriction that it be consistent with the Constitution important? Because literally just weeks after the Supreme Court decided the Jacobson case, they decided another case called Lochner versus New York. And Lochner versus New York was a case in which New York asserted the authority to impose what was maximum hours limitations on bakeries. And what the Supreme Court said, and they claimed that the police power justified it, and they claimed specifically that Jacobson provided a authority for them to do this. Literally, Lochner was argued 3 days after the Jacobson case was decided, and it was decided the same term. What did the Supreme Court hold in Lochner? Supreme Court held in Lochner that the police power is not a blank check for the state to do whatever they want to in the name of public health, safety, and welfare. They have to actually justify the restrictions on individual liberty that they want to do. And so when the court said that the police power must be exercised consistent with individual liberty in the Constitution, they meant it, as shown by Lochner. Now, here's where the story ends up going awry, which is over time, the Lochner decision was overturned by the Supreme Court in that context. And what happened over time was the Supreme Court ended up basically saying states could do whatever they wanted to under the police power. That view hit its peak in 1927 in a case called Buck versus Bell. Now, Lochner is famous because Justice Oliver Wendell Holmes wrote a dissent from the Lochner case, where basically Holmes was a social Darwinist, and Holmes basically believed that the powerful should get their way in society because they're more powerful, and that included the political perspective. And so it's not up to the court to protect minorities from the overarching power of majorities of powerful interest. And so Holmes basically said that that's not our job. Holmes got its revenge in 1927 in Buck versus Bell. Buck versus Bell was a case that tested a law that Virginia had that provided for coerced sterilization of people who were determined to be, quote, feeble-minded or otherwise unfit to reproduce. And so Carrie Buck was a young woman who was raped by a relative, and rather than face the disgrace of that, they sent her off to an insane asylum and basically said she was crazy when she claimed that she had been raped by this relative. It turns out it was true. And while she was there, the warden of the asylum decided that she was feeble-minded because she only had a sixth grade education. She was a poor Southern woman in Virginia, and decided to have her forcibly sterilized. This case went up to the Supreme Court, and Oliver Wendell Holmes, writing for the court, said the principle that if you can tie somebody's fallopian tubes, certainly you can sterilize them. After all, if you can force somebody to get vaccinated under Jacobson, you can also require them to be sterilized. After all, vaccination is much more dangerous to somebody than a sterilization procedure of tying your fallopian tubes. And in his infamous words, citing Jacobson, Holmes said, 3 generations of imbeciles is enough. That view of, and what was the basis for this? The basis for these laws were eugenics, which was the generally accepted view of the consensus of the medical establishment at the time was the view of eugenics, that certain people were unfit to reproduce, and that to prevent what we would now call externalities of society, where people's reckless breeding basically imposes harm on everybody else, kind of like an infectious disease is the way they saw it. We're allowed to sterilize them because wouldn't it be better for society, they said, Holmes said, if instead of allowing these unfit people to reproduce and weaken society and grow up to be criminals and derelicts, we would just cut them off. 3 generations of imbeciles were enough. Now, that was the academic consensus at the time. That was the medical consensus at the time. And it had about as much support as the idea that COVID vaccines prevent transmission. Maybe it actually had more because they didn't have the same sort of data. We know from the data that that's not true about COVID vaccines. Back then, at least, it was an unproven theory. And then this view was upheld and extended in the Korematsu case, which you may be familiar with, during World War II, when using the same rationale of deferring to the experts, they decided it would be okay to simply round up Japanese Americans and put them in concentration camps without any adjudication of their individual loyalty, because that's what the experts said. And who was the Supreme Court to let little things like individual liberty and the Constitution stand in the way of what the experts said was necessary to fight the war? Well, after a while, people recognized that we don't want to live in a society like that. So beginning in the 60s, the Supreme Court started adding back into the Constitution robust protections for individual liberty. And in a number of cases involving forcible injections of prisoners, for example, of medication to help psychologically help people, the Supreme Court said, no, if you want to force somebody to undergo an injection, you have to pass strict scrutiny. And that requires showing not only that it's necessary and that it's the least intrusive way of doing it, but also that it's good for the individual receiving it. You can't just wave your hands around and say, well, society needs this, right? Somehow society is vaguely going to benefit. You also have to show it's actually good for the individual receiving it. And that's where COVID vaccinations come in then, which is there's a number of things we know about COVID vaccinations, which is number one, they do not provide a durable protection against infection and transmission. In fact, we now have 5 studies that show that after 6 months, vaccine efficacy is negative for 2 shots of the vaccine against Omicron. A booster shot boosts it up a little bit to around 50%, tapers off very quickly, such that by about 8 weeks or so, 8 to 10 weeks, you're basically back at 0 efficacy in preventing infection and transmission. And my guess is pretty soon we're going to start seeing that those who have been boosted are going to be in negative efficacy territory, like we are in other cases. And I did an article on Real Clear Markets, if you want to find that, where I go through the studies that demonstrate this. So it's clear that the COVID vaccines violate the first principle of Jacobson, which is that they do not prevent transmission. They are not necessary to prevent transmission. And with respect to specific individuals, it is clear that they do not benefit them. And that is the case with respect to people who have natural immunity, which is first, we've learned natural immunity is far more robust, far more protective against variants than the COVID vaccines are. Right. So there are basically 5 reasons why natural immunity is proven to be more protective than vaccines. The first is natural immunity generates what's called mucosal immunity, which is the first line of defense against infection is your mucosal immunity and so-called IgA antibodies, which you carry in your nose in particular, because respiratory illnesses enter through your nose. The vaccines simply do not provide sufficient mucosal immunity, especially in the nose. They provide a little bit in the mouth. And so that is why specifically the vaccines cannot prevent infection, which is they don't provide protection in the right spot. Natural immunity does. That's the difference. Natural immunity is basically sterilizing immunity. Vaccines are not. Vaccines are injected into the system. They are intramuscular. And in theory, they can prevent serious disease because it circulates IgG antibodies in your system, which means that once you are infected, then you can fight off the disease more rapidly because it basically jumpstarts your immune system, but it doesn't prevent you from getting infected in the first place. And the waning of protection against vaccination clearly tracks the waning of the limited IgG antibodies that you get in your system. Second, it's very clear that natural immunity is far more durable. We see now every single study that's been done shows that the level of protection from natural immunity after 12 or 15 months is at least equal to or better than vaccine protection against infection after 3 months. That was even before Omicron. Now, natural immunity starts off higher than 2 doses of the vaccine. And both Moderna and Pfizer CEOs have admitted that the 2 doses of the vaccine can protect you from infection. The third thing is natural immunity is more resistant to variants, as we have seen again and again. The reason being that natural immunity recognizes the entire virus, including the so-called the nucleocapsid element of the virus. And so basically, when certain elements of the virus change, like the spike protein, natural immunity can fall a little bit, but generally still recognizes the virus. The vaccine, by contrast, is aimed specifically at the now extinct variant, which is useless against Omicron. Natural immunity, the antibodies generated by natural immunity also evolve over time. And so whereas vaccine antibodies are static after they're created, natural immunity continues to respond to threats in the environment and basically grows over time. And the final difference is that natural immunity is less infectious on breakthrough. And so basically what happens when somebody has natural immunity, because it is so quickly suppressed through the mucosal immunity, the people who, in general, people who have natural immunity have much, much lower viral load and shedding activity than somebody who's vaccinated, as is well established now. People who are vaccinated, once they get infected, carry the same viral load and shedding activity as somebody who's completely unprotected without either natural immunity or vaccine. So the idea that it's necessary to require mandates for people who have natural immunity is simply wrong. And that was the issue that we teed up in our case. It's also the case that it has to be beneficial to the individual. I'm aware of 7 studies, every single one of which shows that people who have had COVID and recovered and then get vaccinated are at a much higher risk of adverse events, including serious adverse events such as hospitalization, emergency room treatment, and the like, because of the risk of hyperinflammation of the immune system. So you basically have a situation in which people's immune systems are overinflamed. So in my lawsuit, we had affidavits from Martin Kulldorff, who was supposed to be here today, and Jay Bhattacharya. I'm summarizing what they said, as well as my personal immunologist, Human Norchasm, who's a doctor who also has a PhD in immunology. And so for the state to carry its burden, it's required to actually show that it's beneficial to the individual, and it's actually required to show that it'll prevent transmission and not just serious illness and the like. And when states, and finally, now when universities or states want to impose vaccine or booster mandates, is the case now, they would need to show that all over again. What we have found is the evidence is pretty clear that somebody who has hybrid immunity, meaning they have been vaccinated and then contracted Omicron, like many college students did, that is quite clearly equivalent to at least getting a booster shot. And so requiring a booster shot for somebody who's already had 2 shots of the vaccine, as many of these places have required, and then had an infection after that, is just barbaric, to put it bluntly. And so I think so you're limited in what you can do at private universities in order to challenge these things. But it's worth trying it. It's clearly the case, in my view, that vaccine booster mandates are unconstitutional. The vaccine mandates themselves were unconstitutional as originally structured for state universities. Booster mandates are clearly unconstitutional. And fortunately, in Virginia, we got new leadership in January with Governor Glenn Youngkin, and then with Attorney General Mayorkas, and they banned first Governor Youngkin prohibited vaccine mandates by all state agencies, including universities. And then General Mayorkas extended that to students on the basis that the power resides in the Virginia State Legislature, and the Virginia State Legislature has created a list of required vaccines for students to attend schools, and the COVID vaccine is not on it. And according to a recent article in the ABA journal, not a single state legislature has actually required mandated COVID vaccines. The only people who have done that are governors, university presidents, and other mid-level functionaries in state government. And that clearly does not meet the standard of Jacobson, which requires the state legislature acting through its police power to to exercise that power. So with that, I will step aside and turn the podium over, the virtual podium over to Joni.
Thank you, Professor Zywicki, for your presentation. Ms. McGary, you are up.
I think I'm unmiked now. Can you hear me? Okay. Hi, I'm Joni McGary, and I'm the co-founder of No College Mandates, along with Lucia Sinatra. We met because we both have students at Dartmouth College, and we were in opposition to the booster mandate there, and found it very difficult to find like-minded people because the only way you know other parents is on a Facebook chat group, and those parents are by and large not like-minded against mandates. And so we ended up starting a national organization helping people find each other who opposed vaccine mandates at college campuses. And what we learned, and what I'd like to tell you about just generally, is what these vaccine mandates are on campuses. And I'll talk a little bit about other mitigation method policies on campus, and what that effect is on both the student population, the community, and also on the parents of these students as they try to navigate these restrictions and college vaccine mandates. About 1,000 colleges, now fewer thanks to the election in Virginia, but about 1,000 colleges began to mandate vaccination as a condition of enrollment in summer of 2021. Of these colleges, of these 1,000 colleges, more or less, 325 mandate boosters as well. And over this last year, they have shown no leaning toward dropping those mandates at all. And over this past year, we also realized that the justification for these mandates, which were to protect the individual student's health, to protect them from serious illness and hospitalization from COVID. That was one of that the vaccine was needed for that. And the other thing was is that it was needed to prevent community spread. And we now know, and in fact, we knew then that these vaccines did not prevent community spread. Indeed, it was never trialed in any of the Pfizer or any other clinical trials. And now we know from a year of experience on campuses that these vaccines don't prevent infection or transmission. If they did, these would be populations of people, over 90% of colleges, at colleges that mandate, and even at others that don't, these are highly vaccinated populations. Between 90 and 95% of people are vaccinated. So it's a really nice little test kit, but throughout that year, we still saw COVID outbreaks across campuses at very high numbers. So we know that they just don't work, and yet these mandates continue unabated. I take it a step further. I don't think anybody should be mandated to get this vaccine with or without natural immunity, especially for this particular population. This population is at extremely low risk of hospitalization or severe illness from COVID, and that is by the CDC's own data. So they have a very, very low risk, near zero, of getting complications from getting sick from COVID. But they also, upon vaccination, they take on a risk of injury or harm from the vaccine. And while those numbers are said to be very rare, I'll take one example. In myocarditis, which is inflammation of the heart muscle in young men in that age group, somebody is perhaps 4 times more likely to get myocarditis from the vaccine versus getting myocarditis from COVID. So even just in that case alone, to mandate this product as a condition of matriculation, as a condition of getting an education, is just, it's immoral, it's unethical, it's unsustainable. So again, the 2 reasons that these colleges mandated vaccination is they just don't hold, and yet these colleges continue to mandate. So that's one mitigation that colleges are doing. And then along with that mitigation of the vaccine mandate comes with it compulsory testing. So students are subjected to compulsory testing for COVID weekly, more than weekly. It depends at some places on your vaccination status. If you have no symptoms, if you're totally healthy, you still have to report in for your mandatory surveillance testing. At some colleges, they don't require vaccinated people to test, but at many colleges, even if you're vaccinated, you have to get tested once weekly. And if you're not vaccinated, at certain colleges, you might have to be tested up to 3 times weekly. So that's a student who has no symptoms, who is perfectly healthy. Just because they're not vaccinated, they have to go in and get tested 3 times weekly in order to move about campus and in order to go to class and do all of the normal things. If that test comes back positive, you may be notified on your phone that you have an hour to get ready and get all your things together, or 2 hours, and get into quarantine housing. And during this quarantine that you have, you can't go to class. They don't have Zoom classes anymore. So you're missing class. You can't go to the dining hall. You're often, not given healthy foods or, any companionship. You're just put in this crummy isolation. And often, if you're an unvaccinated versus a vaccinated student who tests positive, you have a much more punitive quarantine on top of that. So there's a lot of discrimination going on because, like Todd said, the vaccinated and the unvaccinated don't pose appreciably different threats to their population. So there's no reason for them to be tested more frequently, or to be masked differently, or to be quarantined differently. And so it brings the question of, are these policies based on science? I would say no. Are they punitive, or are they just done by administrators who are either too lazy or too uncurious to say, wait a minute, what are we doing here to our students? How are we treating them? Are we continuing to do things that are in the best interests of the health and well-being of our student and our faculty populations? And I don't think those questions are being answered. So you have all of those things that result as I think they stem from the vaccine mandates. That's like the first thing that the college does. And then we're going to mask. And the masking is problematic, not only because there's great controversy over whether masks work or don't work, or in fact do harm. Socially, they're problematic. Your face is covered the whole time. You're isolated as a student. You're away from your family. It's just injurious to social health and well-being. And in fact, look at the suicides on campus this year. They've been, much higher than in previous years, and highly disturbing. But also at some campuses, if you're vaccinated, you don't have to mask. If you're not vaccinated, because you have a religious or medical exemption, you have to mask. So your medical privacy is right on your face. And that also brings into question the whole issue of coercion and social pressure, because by and large, unfortunately, the student population appears to be very keen on compliance. They're going to get vaccinated. They want you to be vaccinated. They're fine stepping up and rolling up their sleeves as many times as it will take to be back to normal. In fact, many people believe it's the righteous and good thing to do. So that if you're a student in this mix who is not vaccinated, and you're having to wear a mask, or you're not allowed to go to the gym without your mask, it's a public declaration that you're not in the mix. And I think that is really, really problematic for all the reasons that most of you would agree. So all of those things taken together, you have a vaccine that you're mandating risk to this population. They don't necessarily need this medical intervention. You're discriminating against people based on their status of their most private medical choices. I mean, even if the vaccine were 100% safe, it's not needed in this population. So there should just not be a mandate, but it isn't 100% safe. And then the discrimination is incredibly problematic, and yet no court is taking it up. People are afraid to sue their universities. I mean, it's an environment of fear. If you're not in step with these mitigation efforts, you could be seen as a pariah. And in fact, at some schools, you have to sign an attestation saying that if you see somebody who is not complying with the COVID regulations, you will report them. And that's what you sign when you start your semester. So the environment of this is not only unethical, immoral, un-American, unscientific, to me, unlawful. It also is, these universities are leading and teaching by example that it is okay to govern. It is okay to treat fellow Americans, fellow humans in this way. It is okay to mandate a private medical choice upon them. It is okay to discriminate against them. And by the way, young leaders, we're training you. You go out into the world and you do this too. It's an insidious thing, but it's highly problematic. Also, at some colleges, there are programs such as, like at UC Irvine, they have what's called the ZOT Pass. And at USC, they have the Trojan Pass, which is, I always joke, it's unfortunately named, but you have to take your, and I don't know if they're still doing this, but at the height of the pandemic, you take your biometrics and you put them in every day, and you get the green light and you can pass among the campus if you're okay. So it's this surveillance state. It's complying with medical, you're giving up all of your medical autonomy. And by the way, you're being tested constantly. What is being done with these samples? Are they being used in research? And if you don't sign certain waivers about the results of your tests, and you can't take your tests, then you're out of compliance. Then you can't go to class, you can't, so it's this whole chain reaction of you are under pressure to give up all your autonomy. So the vaccine mandates, the mitigation methods, they're highly problematic at campuses across the country. Our organization is focused very, very narrowly on getting these mandates for vaccinations rolled back. And so what we've done, so that other people are aware of what we offer, we're just a very loose coalition, we're not a staffed organization. But we offer a space on a Telegram channel where other stakeholders can find each other. And so thousands of people have joined our channel. We have a lot of incoming students and parents wondering how to navigate these mandates. And what we tell people generally is, don't go to schools that mandate. Don't apply to them, don't go to them, because even if they've rolled it back or they changed policies, in a minute, they will change them back. If there's a new vaccine, if there's a slight new variant, if the case numbers tick up, you're going to be right back where you started from. So do yourself a favor and, walk away. But many people aren't in a position to do that, or they don't want to do it, or the school has changed the rules after you've matriculated and all of a sudden you've accepted the scholarship, you've signed up, you've committed, and they're going to mandate vaccination. And then where does that leave you? So we would just say that don't go to these schools. But if you are in those schools, some schools offer religious and medical exemptions, some don't. If our advice is, or our experience is, a religious exemption is much easier to get than a medical exemption. Unfortunately, physicians are very reluctant to write medical exemptions unless you had a near-death experience from the first shot, because there's a lot of pressure from medical boards and hospital systems to not oppose the narrative that everyone should be vaccinated. And so it's hard to get a medical exemption. And in some cases, the college will override that medical exemption. In the case at Union College recently, a student was expelled. She had taken the primary series, I think it was Pfizer, and she had terrible reaction to it. She ended up in the hospital. The symptoms weren't typically, they weren't one of the big, like she didn't get myocarditis. She had a lot of gastrointestinal problems, ended her up in the hospital. She continued to have problems, months after that. Then they told her she had to get a booster. So she produced all her hospital records and said, I've gotten this shot. This is what it did to me physically. I need a medical exemption. They said, no, we won't give one to you. So she got 2 doctors to write them for her. They said, why don't you just try the Moderna? They wanted her to put her life at risk. And I don't think I'm overstating that, because with every exposure to vaccination, if you've had a reaction, you're going to be at higher risk for another potentially, more harmful side effect. And yet Union College was willing to put that girl in that position. And so she wouldn't comply, and, she was terminated from being a student there. So this is the kind of experience that people are having across campuses. Now, that said, there are many campuses that don't mandate. There are some that have no restrictions whatever. If you look at Hillsdale College, they take no government money, and I'll talk about the money in a second. I want to make sure I'm not talking too long. I set a timer. There we go. They take no federal funds, nothing. And so they are free to do as they like and set their policies. They didn't have vaccine mandates. They didn't even do testing. They didn't have a COVID dashboard. And I'm here to tell you that if that were a mass death event where faculty was killed by irresponsible students spewing COVID, or the students weren't protected, that would have been in national news. And they just had a perfectly fine and normal year. So that shows all of us that it can be done. So why are colleges still continuing to mandate? That is the biggest question. We've brought them data. We've asked them to provide their risk-benefit analysis to us on how they can practice this one-size-fits-all medicine on their students. We've invited them to engage. One letter we sent to Dartmouth had 40 pages of supporting data. What you get back, if you get anything back at all, is CDC talking points, safe and effective, needed for communities who can't, got to protect everyone. That's all you get. So recently we've taken a pivot and we've sent out a different kind of letter, which if you go to our Substack, nocollegemandates.substack.com, you can get a copy of that. So we've also looked at, the money flow to the colleges. I mean, colleges get billions total of year from the federal government. 61% or so of that money comes from the NIH. They are not a disinterested party in vaccination. Indeed, like if you look at the 8 Ivy League schools, they get over $3.5 billion annually from the federal government. And so there's just so many ties and so much groupthink that's happening that it's a very difficult thing to unwind, because on the face of this, it makes no sense at all. And we happen to know there have been injuries. We know of at least one death that was attributed to the vaccine in the SUNY system. And yet schools at which these things are happening, they continue unabated. These vaccine mandates, they don't stop. And in some places, we know they know because these kids went to the health centers to be evaluated. So that is very disturbing that is happening. And I think there was one more point. Somebody had asked a question in the chat earlier about the CARES money. Colleges are recipients of the Higher Education Emergency Relief Funding. Those things came in 3 batches of payments. The first 2, as far as we can see, had no ties or requirements to any mitigation efforts. The 3rd batch of CARES funding was the problematic one for colleges and also for K through 12. There is a clause in there that says that the recipients of these funds must, I believe, do COVID countermeasures that are evidence-based. So what does that mean? I don't know, but it doesn't say you must be vaccinated to get this money to, a certain number of vaccines, but it strongly implies it. And then I'll say a couple of other things before I wrap up. There are programs such as the White House Vaccine College or College Vaccine Challenge. This is a White House initiative that encourages colleges to promote vaccination, encourages professors and coaches to talk to their students about how safe it is, encourages them to set up vaccine clinics. So it really is a push to get colleges to act as pharmaceutical marketing arms. And 800 colleges have signed up for that. Are they getting paid? Maybe not directly, but they're certainly getting kudos. And the other organization is the American College Health Association, which I want to call out. They are funded in part by pharma and Wellfleet. And they are incredibly pro-vaccine, and they give toolkits for social media to get students and other stakeholders to post on social and to encourage and market vaccination as the right thing to do. So that's the experience on college campuses. I hope that isn't too long and gives a good overview of what we're dealing with. Thank you.
Great. Thank you, Joni, for your presentation. So as a reminder to our viewers, if you have any questions, please send them to me either via the chat or the Q&A button. I already see quite a few discussion and comments here, so I think we'll get started on this. Let's see.
I was following them also, Neetu, while Joni was speaking. So if you want, I can jump in and take some of the questions, and then you can see what I miss. How's that sound?
Sure.
So,
that sounds great.
So first, one comment on Joni's terrific presentation. What's appalling about this, and the people on this call who are in the industry will recognize this, is we all basically we are all serfs for the university bureaucracy these days. And if we've ever learned who really runs modern universities, and it's the bureaucrats in the HR office, they have taught us that lesson over the past couple of years. It's just appalling. At my university, our COVID policies were designed by the university fire chief and the person who is in charge of lab safety protocols. They decided that when my immunologist, who has a PhD in immunology, has taught at Brigham and Women's Hospital and University of Penn Medical Center and has 65 published journal articles. They decided they had to double check when he submitted my exemption request. They decided they had to check it and make sure that he knew what he was talking about before they would grant it. It's asinine, and it's just box checking. And Paul Offit, the head of the who was an FDA vaccine guy, said that that's basically why the federal government hasn't recognized natural immunities. It's too hard to check the right boxes. Give you an example of how asinine this is. A friend of mine works at another university. He's an employee, not a student, that imposed one of these things. He requested a religious exemption, and I think people here will get the humor in this. He requested a religious exemption from that university's vaccine mandate, and this 27-year-old Smith woman, who's an assistant in the human resources department, denied it and told him that she didn't think he had a legitimate legitimate religious objection to this. And this is the kind of absurdity that's going on out there, which is mid-level bureaucrats in university administrations are questioning the judgment and the assessment of people who are submitting medical exemptions from their doctors, explaining why this is inappropriate, from their ministers, attesting to the legitimacy of their religious exemptions. This is clown time. I mean, it's really appalling when you pull back the hood and start looking at what's going on here. And it's amazing that nobody is that people aren't appalled by this. I'll say two other things, which is one, there was a question about the EUA. We raised that question about whether or not you can mandate an EUA. And basically what has happened is the Biden Office of Legal Counsel is in the tank for the White House. And they basically decided the EUA, they issued an opinion that said that the Emergency Use Authorization Act says something different from what it's supposed to say, which is the EUA is supposed to be a patient's right bill. The EUA is supposed to be a vehicle by which patients who want to be able to get access to a novel treatment that hasn't been fully tested for its safety and efficacy, to be able to access those. And basically they waive their right to be able to sue in order to do that. Does that make sense? It's basically a right to try type legislation for people who want to try, who basically have fatal diseases and want to try a medication. It's not supposed to be what they've turned it into here, which is an authorization for the government to then mandate completely novel treatments that have no longstanding track record of proven efficacy or safety, especially in groups such as those who are naturally immune, who were specifically excluded from the actual trials. And so that's why the only basis we have for knowing whether they're safe or not for people who've actually had COVID is clinical evidence, because they were excluded from the trials. The second thing was there was a comment. Let's see. Well, I'll just say one more word, which is Joni said people should start looking for schools that don't require mandates. So I would say, come to Virginia. We'll be happy to have you at George Mason University. And even though the university is probably gritting their teeth, we've got this great governor and AG for 4 years. So you should be able to get through unscathed. Because as Joni said, they refused basically in January, They banned the vaccine mandate for faculty and staff. Soon thereafter, the Attorney General banned the vaccine mandate for students, or the booster mandate for students. What happened at George Mason? Nothing. Absolutely nothing. We went through the entire spring semester without a major outbreak. Meanwhile, massive numbers of schools that required boosters ended up having big outbreaks, ended up having to mask, places like Cornell, likely because the boosters only last 8 to 10 weeks in protection against infection. And so all those students who got vaccinated over Christmas break probably wore off by the time, by the middle of the semester. So we had no problems at George Mason. Our masks came off midway through the semester. They stayed off the rest of the semester, and it was never an issue.
Well, so I have a question here. You know, what made the universities adopt extreme COVID policies? You know, what kind of factors do you think played a part here? And this question is for both of you. Maybe you can have Todd go first.
Yeah, I think Joni put her finger on some of it. I think it's scientifically illiterate and frankly neurotic faculty. Baby boomers have run this country too long, and they've really run universities too long. And baby boomers think that students are just sacrificial lambs for their neuroticism. They are clinging to the idea that the vaccines will prevent infection and somehow protect them. And university faculty are probably the most self-absorbed people in America. And university bureaucrats make Wall Street investment bankers look like paragons of virtue, as far as I can tell, in terms of the ethical standards of university bureaucrats. They are really just these are not good people. Just look at what they've done with Title IX, for example, and their willingness to ruin people's lives for the heck of it, as far as I can tell. So you get basically neurotic faculty, you get neurotic parents who want to believe that this will actually work. And you get, you know, as Rochelle Walensky said, they just had this fantasy that these vaccines were going to do what they thought, right? And so they thought somehow this was going to be a panacea, and they were unwilling to recognize from the beginning that everybody's going to get COVID. Everybody's going to get COVID. If you haven't gotten COVID yet, you're almost certainly going to get it at some point. And a lot of it's just control, right? It's just control. It's leftist. It's the progressive ideology that they are doing it, and they don't trust other people, and so it's just their way of controlling basically everybody around them. And that's a large chunk of this. So that's my impression.
I would echo what you said, Todd, and also just say that I think you're in a thought bubble in a university. It may be 50 years ago that wasn't the case, but increasingly there is not diversity of thought in faculty at universities. And if you are a person who has diversity of thought from the pack, you really stand out. You know, there are a couple of examples, Todd, and then a couple other people I know, one at Cornell, one at BC, who have been outspoken against this. But so you're in a thought bubble. You have an echo chamber of everyone thinking that they can trust the public health messaging, that they can defer to it, that of course we got to follow the science. And so I think that dampens curiosity. And there's also this political charge to asking the question. I mean, the fact that nobody's raised the question, could these vaccines be causing injury? You know, like Cornell had, I think, at least two people last year die in their sleep, students. Why isn't the question asked? I'm not saying the vaccine caused it, but the fact that they don't say, oh, what are we doing differently this year? Maybe we ought to ask that question. So there's not anybody stirring the pot for intellectual discourse there, which is really ironic because they're supposed to be intellectually discoursing. So I think that's part of it. And I think also like Todd said, depending on the governance of a university, for whatever reason, faculty seem to appear, and not just at colleges, look at what happened in the public schools throughout the nation, prep schools, that somehow faculty are uniquely disposed to get COVID harder than anyone else, and they're uniquely disposed to get it from these germ vectors that are students. And so I don't know if that's like a conscious thing they think, but I think it does drive policy at some universities. And then also, I'm just going to go back to the money. Be clear, it isn't just the CARES funding, which is a drop in the bucket of the federal funding that these colleges get on in an annual basis, and the NIH and the CDC and the Department of Defense and FEMA. I mean, it's all public information. You can look it up very easily and see what your college gets. You are not going to bite the hand that pays your light bill. And also, you're going to be on board with their kind of thinking. So, I mean, I'll give you one example. The head of the science committee at one of the Ivy Leagues, the head of the science part of the COVID policy committee, in his lab, he's the PI in a lab. His lab gets $600,000 to $900,000 a year from the NIH. That's how he funds his research. Now, I don't think he's probably a bad guy, but he's not going to buck the system, very easily. So, I just don't think they're giving it a lot of thought, or they're in denial, or, there's something more nefarious afoot, because it doesn't make any sense to continue these policies. They don't work and they're harmful.
Yeah, I'll just add a word to that, which is first, the herd of independent minds that makes up university campuses can't be understated. And as we all know, the cowardice of most university professors and actually taking a stand on anything that's not already properly endorsed. I'm in a unique situation. I teach at Antonin Scalia Law School. I've got a faculty. We are the world's leader in law and economics. We do analysis. We do evidence, and I never had any problems with my colleagues. They looked at the science. They looked at the evidence. They read my complaint. They was like, all right, makes sense to me, right? Most people are not in that sort of world where people actually analyze data and assess data and have the capacity and the intellectual independence to assess this stuff. They're just sort of running scared. And so I don't want to underestimate the fact that I was in an unusually friendly location for this. And I've chosen to teach at that school because I have the world's greatest colleagues, and so I'm unique. So that's my recruiting message for everybody who has undergrads to send me. But I want to say one thing that I think is really important that Joni said, which is, let's talk about boosters, for example. Ironically, right at the time that they were rolling out booster mandates to begin the spring semester, two things about that, which is first, how do you like the bait and switch in the middle of the school year? Which is when students came back for the fall, they said, all right, you get your vaccine and then you'll be safe. And then over Christmas break, they basically dropped a new one on you. George Mason announced theirs on New Year's Eve at 7 p.m. They announced that students are going to have to get vaccinated in order, get boosted in order to enroll in the spring semester. That is, I think, a potential contracts case, but it's really just very unethical, as Joni said. But here's the question: but right at the time that came out, a big study came out in New England Journal of Medicine from Israel that studied their first round of boosters. And what did they find about booster shots for young people, meaning people under the age of 39? They found that it had a limited effect on transmission, and more to the point, they found it had zero effect on serious illness from COVID, whether you were vaccinated without a booster or vaccinated with a booster. In fact, they said there were so few cases, they were unable to calculate an odds ratio that compared the boosted to unboosted populations. And so here's the question I think that boards of trustees and university presidents need to ask, given that there is no benefit to students from this in terms of protecting their health, given that there is no benefit in terms of reducing community transmission, how many cases of myocarditis are acceptable in young men in order to have this virtue signal? What's the number? Is it 5? Is it 10? Is it a dozen? what is the acceptable number of cases of unnecessary myocarditis and other harms to students, given the fact that students this age get no benefit from these vaccines if they've already had COVID or if they've already been vaccinated, which just about every kid in America has had one or the other. And what does that show? What is behind all of this is bureaucracy. What is behind all of this is that the universities will not take they won't take responsibility for what they are doing. That's what I ran into at the university, which is the university basically, it went into this maw of the bureaucracy, of the HR bureaucracy, who generates this kind of garbage. And when you try to ask them what's going on, they basically say, well, we're just following the CDC guidance. So what is the CDC guidance? So that's just this thing over here that the CDC, whatever that is it's just another bureaucracy churning out things. And NCLA, my lawyers, in another case, they challenged the federal employee vaccine mandate. When they challenged the federal vaccine mandate, they said, well, we're just relying on the CDC guidance. So they tried to challenge the CDC guidance. The judge said, well, you can't challenge the CDC guidance because it's not a law. It's not binding, right? And so this is a shell game they play, which is nobody wants to put their name on these things. Nobody wants to actually take ownership of it. They just basically want to wreak this harm and engage in this evil behavior towards young people in America. And nobody wants to take responsibility and say, I'm the one who's responsible for it. Well, we're just following the CDC guidance and blah, 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 right? And it's really just moral cowardice on an appalling level. And so I think if people want to challenge it, I think you need to name names. I think you need to say, this is the person who is responsible for this, President so-and-so, because you can't play nice, because what they want to do is engage in really unethical and vicious behavior and not have to accept responsibility for what they are doing. How many cases of myocarditis are acceptable for a virtue signal? That's the question that they need to ask in whatever variation that might be.
Okay, so I have a question here from Antonio, who asks, are colleges that impose vaccine mandates liable for vaccine injuries?
Yes. Todd can probably take that from a legal standpoint, but it's my understanding that they are not at this point liable, because any organization or entity that performs a COVID countermeasure is covered under the PrEP Act. I don't know if, Todd, you can jump in on that. And so it doesn't seem to me that anyone is suing successfully with that, but there haven't been any injury or death suits that have gone to trial yet. Todd, do you want to answer that?
No, I think that's right. They also generally, basically what they would say is, well, we're not mandating it. We're just saying it's a condition for attendance.
Right. And you can just go to another college.
Yeah. Yeah. And this is one of the things that, that's very important in thinking about this. And one of the reasons I brought my lawsuit was I was concerned about the way some of the lawsuits on this were being structured, which is judges have been very deferential to this. And the judge in the Seventh Circuit, for example, they bought that argument and basically said, well, it's you don't have to go to this college if you don't like if you don't like it, right? And I don't think that's I don't think that's right. Obviously, that's not how we think about coercion in most means of life. It'd be like, well, at this university, our policy is we allow sexual harassment, and if you don't like it, you can go somewhere else, right? That's not how the law works. And so, but basically what they can do is what they'll claim is that you sign a waiver or whatever as a condition for attendance. But I don't think that would be valid in and of itself, although I think they probably think it is.
All right, so some have proposed using the American Disability Act to challenge mask mandates by claiming medical exemption. Do you think this is a viable strategy?
I don't know. I haven't looked at that question. It seems certainly it doesn't seem implausible to me. Partly, one of the arguments I'll make is a lot of this just depends on different universities. Different universities seem to have completely different policies. Some deny every exemption. Some will grant medical exemptions, but not religious exemptions. Some will grant the opposite. Some will grant all the exemptions. It's a really chaotic system. But I think the threat of a lawsuit, I think in a lot of places, is probably enough to get a lot of universities to back down, just because they know it's bogus and they're just doing it for some sort of check the box purpose. So, I've heard from hundreds of people around the country with varying different degrees of success, but just bringing a lawsuit or considering making a disability claim seems like it's something that would have some degree of potential to succeed.
I just wanted to, am I still here? Because we had a power outage and I rejoined. Can you hear me?
I can still see you. I can hear you.
Okay, good. All of a sudden it was gone. Sorry about that.
Did you want to say anything on this, or do you want me
I don't
to
know
move
what
on to the
Todd
next
said
question?
because it wasn't here. I will say the lawsuit thing, it's really difficult to find a plaintiff, students especially are reluctant to be a plaintiff in a lawsuit. I know Santa Clara has one undergoing, they have one, and there may be one coming for a university where the kid, died as a result of taking the Pfizer vaccine, and that particular college, because I went in the Wayback Machine, they promoted Pfizer as being preferred for their students to get, which, how dare they even say that, but they put it on their website. So I don't know what's going to happen with that. And I think, you were talking about the exemptions. Yeah, it is a totally random thing. And I don't know if you mentioned that some of the religious colleges, those are the hardest places to get religious exemptions. And even if in the past, I know Boston College, my understanding is you can have exemptions for every other vaccine. The minute COVID came out, you could not get an exemption for that one, but your other religious exemptions for the other vaccines would hold. Why? I mean, why? And one other point I wanted to make, you were talking about myocarditis, how many cases, do we require to be able to make this virtue signal? One thing that people don't stop and think about is this is a product being mandated to people of their, reproductive years. These are people in reproductive years. Most of them wish to go on and reproduce. There is no long-term safety data at all on the reproductive system in men or women from these vaccines. None, because there can't be. They're new products. So they were rolled out after 28 days of clinical trials. There is just no data. We do not know the effects on fertility. And in fact, we know that many, many women have experienced menstrual disruption, which, you can brush aside and say, oh, it's no big deal. It's self-limiting. It's short-term. Why should they even experience that? There should be caution. And yeah, kids can choose a different school, but the issue, especially in state systems like SUNY, like UC system, like all the Virginia schools, many, many people can't afford to go to private universities or go out of state. They were counting on their state colleges. And now what do? It's totally unethical and un-American and dangerous.
Yeah, I've heard from a student at University of Maine who was from a rural community in Maine who had gotten into Maine with really good grades, had a full ride. She had never been vaccinated for anything. She had natural immunity to even the stuff like measles and stuff like that. That's how dedicated she was. She was but they imposed. They wouldn't even though natural immunity is recognized. In every state recognizes natural immunity as qualifying for so-called vaccine mandates. States don't have vaccine mandates. You don't have to get a vaccine to go to K-12. What you have to have is demonstrated proof of immunity, whether it's measles or whatever, including naturally acquired immunity. How do you demonstrate that? You demonstrate it by doing an antibodies test, whether it's measles or rubella or mumps or whatever, right? What the states require, it's an immunity requirement. This girl had gone her entire life without getting a vaccine, I think because her family may have had a religious thing. And then all of a sudden the university was going to impose a vaccine mandate with no exemptions. They wouldn't recognize any exemptions. It's not like this girl was freeloading. It's not like this girl, and she basically was being forced to give up her scholarship and her ability to attend college, or get her first vaccine that she's ever had because she had survived all the other ones. It's incredible.
Okay, so I have a question. Oh, wait, let's see. Okay, I'm going to try this question out here. So this is from Cap Ed. Does anyone know of any research on return on investment for online degrees from in-person schools paying in-person tuitions? I don't know if that's related to this, if you guys are comfortable, or we can move on.
I don't know of any studies, but based on my own life experience at this point, 5 years ago, I would have thought, oh, you got to go to college, you got to do this and that. I don't know. I think that if you're scrappy and you're willing to do online and, navigate that, and you're a hard worker, I think it's a personality thing. I don't think you need to submit yourself to this kind of insanity and tyranny. And if you don't want to do it online, then just find a college that does not impose these restrictions and does not make you give up your bodily autonomy and your freedom.
I did see a question here from Jeffrey Ludwig. Yes, CUNY counts as a state, counts as a public institution, so would be subject to the Constitution. So,
we actually are undertaking a CUNY-wide. We're mounting a CUNY-wide effort to do a letter to them. So, if you're interested in helping with that push, info@nocollegemandates.com. Somebody asked about, I put a link to our Substack in the chat so that you can read our current letter going out to colleges and universities across the country, putting them on notice about the Pfizer documents that were, came out as a result of the lawsuit. The Pfizer wanted to sit on them for 75 years. We believe that the stakeholders at the colleges don't even know about these documents. They have no curiosity, and they wouldn't learn about them on the nightly news. It's not being covered in the mainstream media. We're putting them on notice that Brooke Jackson is the Pfizer whistleblower and some of her allegations. And also we're putting them on notice that there is an alarming rise in excess death in young people that is unrelated to COVID infection, and is being seen to cluster around mandate dating and booster dating. And it's coming out of the insurance industry. And we're letting colleges that mandate know that it's incumbent upon them to know about this information and to understand what that implication is on the safety and efficacy of the products they are forcing upon their students. And we're sending it certified mail to the president, to the general counsels, to their risk management guys, to their athletic directors, and to every single board of trustee members. So far, 1,500 people have gotten this letter. And we know that, or we suspect that the general counsels at least are reading it, because we inadvertently sent it to a college that does not mandate, and their general counsel got right back to us and said, by the way, we don't mandate. You sent this to us in error. And I was like, yes, what a happy accident. These letters are getting read. So we're hoping that something is going to shift as a result of this letter campaign. And we believe that it will, because we're calling these people out and shaking their cages. I don't know what it's going to take with this group of tyrants.
Don Camerota asked about the legal implications using personal confidential medical information. I think there is an issue here, but there's a whole nother issue, right? Which is everybody here knows how amateurish universities are with data security. I got my, I've got free monitoring, credit monitoring, because George Mason got hacked. And my, social security number, that information was stolen a few years ago. The universities are a joke when it comes to data security. We all know that. And at George Mason, at one point they sent out an email where all the students who were unvaccinated were supposed to be in a BCC, but they sent it out as a CC. So basically, every unvaccinated student in the George Mason system was announced to the world by some bureaucrat at George Mason. The other thing that was great was, this is another classic, which was after the governor said that we wouldn't have to be vaccinated or disclose our vaccine status, I contacted the university and said I would like to remove my vaccine disclosure from the system, and the response was, the system doesn't allow us to do that. They had no capability for removing you from the system. It was like the Hotel California, right? You could check out, but you can never leave. Eventually, I think somebody went in and manually removed me because I kept badgering them. But this is the way these places. This is the level of ability of these universities. So.
Well, okay, so as time goes on, do you think it will get easier to have successful lawsuits against these universities or to be able to file them?
I hope, yes, I think so, which is, it's becoming increasingly hard for them to hold up the sham that somehow this actually does anything except harm students, right? It's kind of they're kind of playing games right now, which is a joke. I can't remember where the algorithm now is. Is it on odd days that they claim nobody thinks the vaccine prevents transmission, and then even days they say it does, or is it vice versa, right? They just play a shell game where they pretend like it still prevents transmission, but everybody knows it doesn't. My concern, Joni, I were talking about this, my concern is that they may do another wave of this come the fall, claiming that they've got this new variant, booster for Omicron, which what they are formulating right now is already extinct. And keep in mind that we are boosting people with an extinct variant. And this raises a whole risk of something called original antigenic sin and antigenic seniority, which is in the article that I circulated in the chat if you want to read it, which is a very big problem. It's a well-established risk. And there's some evidence that it's happening here, which raises a question of whether or not an Omicron-specific booster shot is even going to work. And there's big doubts about whether it will because of this antigenic priming issue. So they may try this wave one more time, trying to play this booster game. Some of them talked about requiring annual boosters and all this sort of stuff. But as more and more as it becomes obvious that they don't prevent transmission, that they don't reduce community infectiousness, I think hopefully judges will start to get some guts on this. And this is why I drew the direct comparison to Buck versus Bell, which is courts have to step up. Courts have to actually assess the arguments that are being made. Otherwise, we are still in Buck versus Bell. The science here of this preventing infection transmission is about as sound as the science that underlay Buck versus Bell. And basically what judges have done is simply deferred to the so-called medical consensus, and that is not allowed under the Constitution. You cannot just wave your hands around and say that the Constitution is subject to Anthony Fauci's dictatorial whims and assessment of the science, because that's how we got the Buck versus Bell, and that's how we got the Korematsu. And I don't think we want to go back, but that's what they're saying, which is just defer to the experts and don't look at the evidence separately.
One point I'll make on that, as far as future lawsuits, in general, remember that our team is growing, right? It's a one-way movement. Nobody from our team, the people who have real concerns about this, are defecting to the team that is all on board. It's not happening. I don't know. It's all the other way. Now, it's not happening fast enough, but it is happening. I mean, when you look at the, for instance, when we started out at Dartmouth and I posted on the Facebook page, who wants to oppose the booster? Maybe we had 12 people. Well, a couple of months later, we had 40, right? So there are points of hope, and I would encourage everybody to just be brave enough to step up, speak up, raise your hand, because you don't know the cover you're giving to somebody else to speak their mind. We can't tell with each other who's who, but if you give someone else cover, maybe you'll find out that they have concerns too, and you get enough people, and then maybe students will be brave enough to step up and be plaintiffs. Nothing's going to happen with one thing. It's an incremental thing, and you don't know which flake of snow, I hate to use the word snowflake, is going to cause the avalanche. And that's why, like with our letter campaign, with all of the things we do, we're just trying to do death by 1,000 cuts. And again, so our numbers are growing. Keep that in mind. And it's up to all of us to help those numbers grow and to do what we can to restore medical freedom for this.
And that's a great point, Joni, which is I had an incredibly brave student at George Mason who I think who basically said that I helped to inspire him, which is the governor, when the attorney general stepped up and prohibited vaccine mandates for students, a lot of that was because of this instigation of this young man, Robert Filner, who really went to the mat, did a petition, got hundreds of signatures from students, faculty, alumni against all this. And I think it's clear that one person standing in front of the tank encourages others to do it as well. My view is I'm a tenured professor, and that means something. And I don't expect an untenured professor or a student to stand all by themselves. But this is what I can. But this is what I can do, and I suggest others who are in that position of being tenure, of having the ability to speak your mind, should consider using that platform to help others, especially to speak for students and untenured faculty who may have the same sorts of concerns.
And I'll make a point on the end of that. People criticize the parents in this movement as being helicopter parents. And some people will say, the students have to stand up for themselves. Yes, they do. We wish they would. But until they do, until they can see clearly, I will stand up for them. I mean, I have no problem with that. This isn't even about, it's not my own kid. It's about the fact that this terrible crime is being committed against young people on so many levels, psychologically, physically, sociologically, all of those levels. So I will stand up for that. One thing I saw in the chat, somebody asked about FOIA. Can I take that question?
Yes, absolutely.
Information asked. They asked if sometimes there's a kernel in their docs that really helps. There's a group in Ohio that has used FOIA requests, which is Freedom of Information Act requests, to great benefit. And I think that you're going to see more of that happen. So, and I'm not an expert in FOIA by any stretch, but you can get access to, especially public universities, to all the email records. You have to just know how to request them. And those things reveal a great deal. At one school, they revealed that the university was doing, like, for the religious exemptions, they were requiring a notary public to sign all of the religious exemptions. Why? I don't know. But they also said there are 4 notary publics near campus. What they were doing, and this was evidenced in their email, they were not saying to the kids on campuses who would never think or know this, there are probably 50 notary publics on this huge campus, that they could just buzz into somebody's office, the ombudsman, whatever, and get their thing notarized. But they didn't give that information to students. Why? Because they wanted to make it more difficult for those students to get a religious exemption and make it costly for them to do that. That is something that came out of a FOIA request. So if you are inclined that way and there's something specific you want to do, get the tools to do it and do it. Don't wait for somebody else. If you want to act, don't say somebody should do this. You should do it. And you have all of the skills and wherewithal to do whatever you need to get done here. You really do. Sometimes you have to do it under the radar because you don't want to have risk. Maybe you find somebody else to run cover for you. But, when I was sitting on the couch January 2nd, when I put out a tweet and said, does anyone want to, oppose these things? And we have several thousand people in our movement now. I had no special skills. I just decided to ask the question and get it done. So I get very excited about that. We all have to get things done. And FOIA is a great tool. These are public documents. You can get them. Sorry, I get a little excited about these things.
No, FOIA is a great tool. You can get a lot of information that way. As a researcher, I use it as well. So it's a really good tool. As we're getting close to the end here, I want to close out with this one question for the two of you. How can we prevent these future abuses from authoritarian figures, especially at our universities and in public health? What can be done to prevent these future abuses?
Yeah, I think that's the right question, right? People talk a lot about social credit system coming to the United States. I think it's pretty easy for us all to imagine a social credit system coming to universities. Basically, they already have it. When you think about kids who've been kicked out of school for things they've said, or had their acceptance to schools, colleges withdrawn because of things they've said on social media and that sort of thing. These are pretty totalitarian places. We know that, and the left is becoming even more aggressive about doing that. So what do I think is the lesson? My lesson, what I take away from it is you need to respect the principle, right? You need to respect the slippery slope. A lot of people I talk, so a lot of students and faculty who I talked to said, well, I didn't want to get vaccinated, but they told me it'd be one and done. And then, so I just decided it wasn't worth the trouble to fight it, right? And I tried to warn them at the time, it's not going to be one and done. You're signing up for an automatically renewing annual subscription. I didn't know it would be less than annual. I didn't know they'd be able to 4 shots in less than a year. But I tried to warn the principal, and it's the same thing with free speech, right? Well, it's just the Nazis, right? Well, it never ends with the Nazis, and it's not going to end with this either. And so I think that the lesson to learn here is they're playing the long game. The left in particular is playing the long game here. And so you should be aware of the principle that's embedded, whether it's this or whether it's the now the things that they're imposing in terms of diversity statements for hiring and promotion and tenure. We all know where that leads, right? Which is they don't stop unless people push back. And the time to push back is at the beginning, not after you've conceded and basically yielded on the principles. So that would be what I would say, because this is going to be the prototype, the precedent that they're going to use for other sorts of things, maybe just with contagious diseases, but I'm guessing for other things. They've got the surveillance systems set up now. They've got the QR codes set up. They've got the mindset of mass compliance by student, faculty, and staff set up. And we know that the way the left and progressives are today, once they have that in their fingertips, they don't let it go. They just push it and push it and push it. And so that would be what that would be my comment.
I agree with everything said there, Todd. I would just say that we already taught, as a society, we taught our overlords what we will do. Every time you comply, you signal to somebody that you're compliant. And it's just more data. And that line, they just keep shifting it. And if you push back, they'll back off a little bit, but the starting point is here, not here as it used to be, right? So you can't yield an inch. And it's like you said, you remember the principle. You have to be brave. You have to be willing to be disliked. You have to be willing to argue with people or softly bring them along. I think that the younger people, if you're going to have children, if you are young, if you can talk to young, influence young people, bring them around, try to get them to understand what is at stake here. Our public schools are, I used to think it was great to send people to public school. I don't know. I think there's a lot of indoctrination that goes on there. And I even know, there's a lot of compliance. Just stop complying. Say no. The next thing comes around again, don't do it. Just don't comply. If people just stood their ground, they would realize they can't do this to us. So, I think it really is as simple as that. What you tolerate, you pass on to your children, you pass on to the next generation. The freedoms that you give up, they won't even know ever existed. I mean, that's the face. And in terms of like the surveillance system, I moved my kid into an apartment for the summer in New York City. His phone is his key. That's the only way he can get into this building and into his apartment. Don't tolerate that stuff. Think about the privacy you've lost. So all of those things together, every transaction you make, think, is this making me less or more free? And then think if you want your children and their children to live in that world. So you just can't yield. You have to be brave.
Great. Thank you so much, Professor Zywicki and Ms. McGary, for joining us today. And this was such a great conversation. And thank you to all of our viewers who are watching us live or who will watch us in the future. If you really enjoyed today's conversation, then you might be interested in a webinar we're hosting on Friday, June 24th. It's called Scientific Culture, Has It Changed for the Better? This will also be available, or this particular webinar will be available for view on our National Association of Scholars YouTube channel as well. So thank you, and I hope all of you have a good day.
Thanks,
Thank you,
Neetu.
Thank you, everybody, for your questions.